How do I minimize tension on incisions to give you the best possible scars? I'm Dr. Victoria Aimé. I'm a plastic surgeon in Scottsdale, Arizona, and I'll tell you about several of the techniques I use to give you the best possible scar. So why do we see unsightly or widened scars? Oftentimes that has to do with how much tension is on the skin incisions while the wound is healing. So typically those skin edges are trying to pull apart. They're being pulled in both directions. We want to try to minimize that as much as possible so those skin edges are barely touching. It gives them the best possible undisturbed state so they can heal as a fine line flat scar. So the three techniques that I use are: number one, long lasting sutures that are deep in the incision. So deeper layers holding that strength layer together, and that helps take tension off of those skin edges while it heals. The second thing I do is use progressive tension sutures or quilting sutures. This is particularly with things like tummy tucks. And what that does is helps distribute the tension over the entire incision. So when it comes to the tummy tuck, we put sutures between the skin edges and the muscle all the way down. That helps take the tension off. By the time that we get to the incision line, there's very little tension on it, and we don't have to worry about all the tension from the entire area all the way up. So that's the second thing I do. The nice thing about that is that it also decreases the need for drains. So typically in my tummy tucks, I don't use drains for that reason. The third thing I do is I tend to use these long-lasting dissolvable staples. So there's no metal in them. They look like this. Basically, they help evert the skin edges, so there's very little tension on those skin edges as they heal. These are actually made of a long-lasting suture material. Now, these are all dissolving sutures. When it comes to breast and body, typically use only dissolving sutures, but I do tend to leave the suture knots outside the skin. And so when someone comes back at about 2 weeks, then we'll clip those little suture knots. There are some things that are outside our control. So your genetics, if you're prone to hypertrophic scars or keloid scars, how you heal post-op care, if there's any sort of complications, things like that. Those are things that are sort of out of our control. But these are the three techniques that I use during surgery to better control how well your scar will turn out as you heal.